So you finally got hired! Congratulations! Yay! So today we'll talk about what you can expect from your orientation week. Details up next. Hi, my name is Veronica. I create informative videos about nursing career and what it's like living here in New Zealand. If you find that topic interesting, then please consider subscribing. So obviously there will be differences depending on where you are going to work. So if it's a public hospital, private hospital, or if it's a small aged care facility or a large aged care facility. However, on its core, your orientation period will have three components. You'll have information about the organization or organizational structure, IT or IS training, and ward and unit orientation. So I used to work in a small aged care facility before, and now I'm working in a public hospital. So the information that I will share is based on my experience. And one of my friends used to work in a private hospital as well, so I will share his orientation experience to you as well. But just keep in mind, your experience may be different, and again, that's okay. So the orientation date and time will be provided to you by either the HR staff or by your manager. For me, when I was working in the aged care facility, I had to do mandatory training such as CPR, basic life support, infection prevention and control, and manual handling. And then I've also spent time with senior nurses in the morning, afternoon, and night shift, just looking at what the routine is like, how to go over different processes, completing forms, familiarizing myself with residents, and what to do in cases of emergency. Now, in my channel, you'll probably see a lot of times where I talk about emergency. I'm sorry if I am quite repetitive about that. It's just really my thought that it's important things to know. Hopefully you won't need it. Hopefully it'll be all smooth sailing. You're working here in New Zealand, living in New Zealand, all smooth sailing. But just in case you do need it, that's the information is available to you. Okay? On the other hand, if you're going to work in a public hospital, they usually set a specific date for organizational orientation. So this means that all new employees are welcome formally to the organization. So there will be executive team members like the CEO, COO, and general managers of different services like Maori Health Services. And they usually talk about the initiative in your workplace, any new projects. And there will also be opportunity from HR to talk to you about your responsibilities, maintaining confidentiality, professionalism, and also talk to you about your rights. So, for example, if you're having difficulty at work in case of bullying or harassment, they'll give you information on what to do and also provide you with information on possible support in this difficult time. And if you haven't joined a union member yet, then you may consider joining. If you have the information at hand, you can decide on that as well. And then they'll also talk about staff benefits. So, dito may mga pa-discount kapag staff member as long as you show your ID. And depending on saan DHB ka magwo-work, maaaring may mas maraming benefits or mas marami silang businesses na may ino-offer ng discount sa staff. So, depende lang talaga yun kung saan kang area dito sa New Zealand magtatrabaho. There will also be staff from Professional Development Unit, and they'll talk to you about learning and development, accessing the library, doing your mandatory trainings. Some of it will be face-to-face, most of it will be online. So they'll give you instructions on how to access those trainings. For example, mandatory trainings would be health and safety, infection prevention and control, fire, electrical safety, and then others, manual handling like I've mentioned previously. We also have to complete drug calculations and IV medications, okay?
If you are enjoying this video, please don't forget to hit like and subscribe. Salamat po!
Next is IT and IS training, specifically because most of the patient information here in New Zealand are stored electronically. So they'll just teach you how to access and view patient records, clinical lab results, relevant diagnostic testings. They also use a workload management system here in New Zealand. It's called DenCare. So you'll be given opportunity for training for that and information. So TrendCare system has many features, one of which is measuring patient acuity. So it will be depending on how much help your patient needs. For example, is your patient independent, or do you have to do a lot of nursing intervention with a particular patient? So it just helps with managing workload, distributing staff allocation. Finally, you'll be given orientation in your actual ward or unit with a preceptor or a senior nurse. You'll spend orientation for morning shift, afternoon shift, and night shift, and you'll go over the routine. You'll tag along with the preceptor, looking after a patient, what is a typical day or shift like, and you'll be more familiarized with using electronic applications at work because you'll see it in action. Personally, I find it's easier to learn once you're actually doing it rather than sitting in a classroom setting, but I know different people learn differently. So anyway, just keep that in mind, that even though you're sitting for like for example for IS or IT training, perhaps it's a little bit complicated, just keep in mind that you'll have opportunity to do hands-on activity, hands-on exercise with it. So hopefully that'll help you remember things better. And you'll also be given opportunity to look at the forms available in your hospital. How do they do referrals, for example, when discharging a patient? So some hospitals do online referrals, others still complete paper form and then just fax it to the relevant care provider. So those little things, I suppose. And if you are working in a private hospital, like I said before, I don't have any experience at all. So I asked a few friends and they said the orientation takes about a month. So there's also online learning, paper-based learning. There's quizzes that you have to complete. And like I said before, with private hospitals, they mostly do elective surgical procedures. Therefore, the questions will be involving surgical procedures as well. And I think they also have days with medical representatives. I'm just looking at any new products, providing information for any new equipments as well. Okay? And just a quick reminder, sometimes during the orientation period, it can be very overwhelming because you're trying to learn a lot of things and you're adjusting to a new country. So I just try to focus on 3 things. This is just me, ha. Number 1 is I try to complete all the mandatory trainings as soon as I can so that I don't have to worry about those things when I have my own workload. Number 2, get to know the members of your team so you know who to ask for help or who to refer your patients to if you need to. And number 3, know where things are. Because sometimes when you have your own workload, much of your time is wasted looking for where the equipment are, where can you locate this form, or even in cases of emergency. For example, there is a medical emergency in your ward. Sometimes you may not be the first person to actually care for that patient, but you can help by knowing where things are. Where's the emergency trolley? Where's the call buttons? Where's the duress button? So yeah, complete the mandatory training as soon as you can. Know the members of your team and know where things are. I hope you found this video helpful, and as always, I wish you all the best with your journey, and I hope you'll have a blessed day. Bye!